Hello. Welcome. Thank you so much for coming in today. So, I see that you have recently been coming in quite a bit for my express visits for people who don't have too much time or people who are just running late for things. So, I welcome you for coming into a much slower paced examination where I can take my time and make sure that everything is okay with you. Today's examination is going to be a cranial nerve exam, and we're just going to make sure that all your cranial nerves are working properly. Before we begin, how are you doing? Okay, excellent. I'm doing well myself. So, as I get these gloves on, I was just straightening them out. I'd like you to go ahead and square up with me, just like you are in the seat. You can go ahead. And no, I don't mean as if you're going to physically harm me. I mean square up with me by getting directly in front of me and just making sure that you're properly aligned with me so that I can properly look at you and assess how you are doing. Okay? Excellent. Very good. So before, again, we begin, I'd like to know, how is your diet? Have you been eating? Very good. It's important to eat. Have you been drinking water? Okay. And have you been drinking alcohol? Okay. And how many times a week have you been drinking alcohol? Got it. And have you been smoking? Or do you smoke? Okay. Well, if you do smoke, I just want to make one thing clear. These are not vapes. So, I know they look similar, but they're not. So, please go ahead and take a nice deep breath for me. Very good. And now I want you to hold it. And now release. Good job. How'd that feel? A little stress relieving? Good. Exactly what I was looking for. So let's go ahead and get this on. Give it a little bit of warm up. I know sometimes it can be a little cold. And let me go ahead and just place this on your chest if you'll allow me to, please. Thank you. Excellent. Very good job. Okay. Heart seems healthy. Heart seems all right. And have you had any kind of allergies? Been feeling a little sick of any kind, whether it's maybe like a little stomach bug, stomach flu, a little bit of a flu, a cold. Okay. So I'm just going to go ahead and check your temperature really quickly. Very good. And I'm just going to ask you to move back just a little bit. There we go. Sorry if that hurt you when I tapped you on your shoulder. Let's go ahead and check that one more time. Very good. Excellent. Okay. Just go ahead and write this in. Okay, so seeing as you've been coming in very frequently for my express visits, what I'm going to do, well, I'm sure that you already know how this is going to go. Excellent. Okay. What was that? No. Actually, I actually had my lunch a little early, and yes, of course, it was a sandwich. But we're not here for the sandwich, we're here for the exam. All right, so let me just quickly check this. Go ahead and move that. Okay, so we're going to go ahead and start off with a smell test. Okay, and we're going to start off with this one right here. Okay. There we are. Just wanted to make sure it's well mixed for you. And if you will, please go ahead and smell this one. And please let me know what you think this is. Okay. And what'd you think of that one? Very good. It smells like grapes. Okay. Let's go ahead and grab the next one. Okay. There we are. And if you'd like to have a smell right here. Very good. Okay. And what did you think about that one? Excellent. That one is, yeah, you were right, by the way. It was lemon. And we're going to go ahead and have you smell now the very last one here. Let's get ahead with a quick mix. There you are. There we go. And how was that one? That was a pretty good guess. That one actually is cough syrup. Okay. Excellent. So now I'm just going to go ahead and ask you, what was the last time that you had a eye examination or that you checked your eyes? Okay. Okay, so I'm going to to do here is I'm just going to ask that you please, at the very least, just want you to go ahead, please, and look straight ahead. Okay, we're going to start off on this eye right here. Okay, and I just want you to listen to my instructions and please follow accordingly. Okay, so I'm just going to go ahead and take a look. I want you to look straight. Okay, very good. Very good. Very good. Excellent. Please look right here at the light. Very good. Very good. Good job. Now, do you see that eyeball that is currently behind me on the desk? Yes. Good. I want you to look at that. Good. Now, please look at the light. And back to the eyeball. And back to the light. Good. Now, look straight up. Good. And now look at the eyeball. Look up. Eyeball. Light. Eyeball. Light. Up. Light. Eyeball. Up. Light. Light. Good. And you can relax. Good job. Let's go ahead and adjust this really quickly. There we are. Can you please look directly at the light once again? Good. Good job. Okay, that's exactly what I was looking for. Now, please, once again, I'll ask that you look straight ahead. Very good. Let's go ahead and set this back to default. Good. And once again, you're looking straight to the back. And let's go ahead and just, there we are. Good. Good. Now, if you could please look at the light right here. Very good, very good. And if you can now please look at the hourglass. Good. In case you've not seen it, the hourglass is right here. Okay. So you're just going to look at the hourglass right now. Very good. And now you're also going to look at this is a pocket mask, okay? I'm just going to call it yellow for now. Okay, make it easier. So you're going to look at the hourglass, look at the light, look at the pocket mask, the light, yellow, hourglass, yellow, hourglass, light, hourglass, light, yellow, light, yellow, hourglass, light, yellow, hourglass, light, hourglass, yellow, light. Now look at the brain chart. Very good. Now look at the light. Stay right there. Good. Just go ahead and adjust. Excellent. Let's go ahead and have you look directly at the light for me, okay? Very good. Good. Excellent. You can go ahead and relax. By any chance, do you wear any kind of corrective lens, whether that is glasses or contact lenses? Okay. Excellent. Good to know. Good to know. Okay. Now, I know that it seems to be that it has been a while since you have taken an eye examination for corrective lenses. So, if you'd like, we can set something up for you so you can come back. Okay, excellent. So, for now, let's go ahead and continue with this, and we'll talk about that afterwards, all right? Excellent. Let's go ahead and take a quick look here. Okay. So, here's what I'm going to do for you. I'm going to go ahead and just warm up your eyes a little bit, okay? What I'm going to have you do is I'm going to have you cover your left eye. Very good. You can cover it with your hand. That's good. Good job. So, what I'm going to ask you to do is, can you clearly see this chart? You can see it. Okay, good. So I'm just going to ask you, and you can see the numbers on the side, correct? Okay. So we're just going to go ahead and I want you to just read down all the numbers that you see on the chart. Okay. You can count them one by one. It's okay. Good. Now, please go ahead and switch. So now I want you to cover your right eye. Good. And same thing, I want you to go ahead and just read all of the numbers on the chart. Okay. And how did you feel? Did you feel like maybe you were maybe forcing one eye to see a little bit more than the other one? Okay. So with your right eye covered, since that's the one that we finished with last, I'm going to go ahead and ask you to please read line number 4, but I want you to read it backwards. So you're going to start from here and end here. Okay? Good. Good. And now I want you to read line 5, but go the other way. So you're going to start here and finish here. Very good, very good. So please go ahead and switch, and now we're going to cover our left eye. Good job, excellent. I'm just going to go ahead and ask you if you can read the top letter, the one on the number 1. Good job. And now let's see if we can have you read line number 4, and we're going to read it straight. So we're going to start from here and end here. Very good, very good. And now, if you will, go ahead and read this line right here, which is line number 6. And if you could start right here, start from this letter, because I know that this letter is a little blocked. So start from this one and read on. Okay. Very good. Now, you can go ahead and open both eyes. Good. And now with both eyes open, I would like you to read all the letters on line number 7, but I want you to go backwards, okay? Okay, very good. And just for a little fun, can you at all see the lines on line number 8? Okay, okay, that's good. That's okay. Now we have 2 bars right here. Can you identify the 2 colors that are on these 2 bars? Very good. Very good. Good job. Okay, you can relax for a second. Okay. Let's go ahead and grab this. A couple quick notes. Okay. So I'm going to be holding up a couple of numbers with my hands, okay? So what I'm going to ask though is that once again you're going to be covering your eyes with your hand. So we're going to cover our left, we're going to cover our right, and I'm just going to hold up a number, and you're going to let me know what number you see with each individual eye. Just trying to find out if there is one eye that can see better than the other. See if there's one maybe that's lagging behind, okay? Excellent. So what I'm going to ask, we're going to start off by covering our left eye. Right? No, your left, not mine. Good. Okay. So I'm going to have one hand close and I'm going to have one hand far so we can see if there's any kind of difference with distance, okay? So I'm going to start off and you just let me know what number you see, okay? Good. 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 Very good. 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 Good job. Good. Very good. Excellent. Now, please go ahead and switch for me. Very good. Now we're going to switch positions, okay? Are you ready? Okay. Good. Excellent. Good. Very good. Good job. Very good. 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 Excellent. Good job. Very good. Go ahead and relax and just take a second. Okay. Okay, so, all right, so almost forgot to ask you, we do have a fit check that I do need to check that I forgot to ask you when we first started. How tall are you? Okay, and can you please tell me how much you weigh, or what was the last time you weighed yourself? Well, how much you weigh, if you know? Okay, about kind of. Okay, and when was the last time you actually weighed yourself? Okay, excellent. Good job. Okay, good. Okay. So here's what we're going to do now is I'm going to ask you to please look at my chin right here. Okay, you're going to look at my chin. Okay, very good. And I'm just going to move this light in and out of your peripheral vision. And what I want you to do is let me know when it leaves your peripheral vision, okay? What that means is if you're looking at a fixed point right here and it leaves your field of view, meaning you can no longer see this light like this. I'm sure you can't see it right here, okay? I just want you to let me know that you can't see it anymore, okay? Okay, so what I want you to do is you're going to cover your left eye. Good job. And you're going to look with your right eye. You're going to look right here at my chin so that we're straight away. This is why I asked you to square up with me in the beginning. Very good. You can put your hands down. Again, no violence here. Okay, so you're going to try and let me know when this light, or you're going to let me know when this light no longer is visible to you. Okay, here we go. Good. Good. Good job. Good. Excellent. Good. Very good, very good. Very good. Good job so far, good job. Good. Very good, and relax for a second. I'm sure your eye's a little dry, okay? You can go ahead and cover your other eye now, so you can go ahead and rest the other one. And same thing, okay? Once again, you're looking here, letting me know when you cannot see it anymore, okay? Good. Very good job. Good. Very good. Good. Good job. Very good. Good. Good, good, good. You're doing amazing. You're doing amazing. Very good. Okay, excellent. So go ahead and take a break. And go ahead and blink a few times if you have to. Okay. Let's go ahead and just take a quick note. Quick note. Okay. So here's what we're gonna do. We're still working with this light. So now what I'm gonna ask you is, actually let's switch lights. Okay. Use this one now. So what I'm going to ask you to do now is this time you're going to actually follow the light, okay? But this time I want you to keep both eyes open, all right? And what I want you to do is make sure that your head does not move. So we're only following with our eyes, okay? So wherever the light goes, your eyes go. All right, ready? Here we go. Remember, you're just following the light, only using your eyes. Only your eyes. You're following the light. I know it can be relaxing, and your eyes can sometimes feel like they're feeling a little drowsy, which is good. Means that they're doing their job. Very good. Just follow the light, just like that. Very good. Very good job. Excellent. Okay, let's go ahead and have you cover your left eye for me, please. Yeah, just like that. Good, good. Same thing, you're just following the light. Keep maintaining your head as still as you possibly can. Very good. Good. And now switch for me. So you're going to cover the other eye. Very good. And same thing. Just keep following the light. Good job. Very good, very good. Excellent. So go ahead and relax for me. Once again, I want to take a couple notes so that your eyes can catch up a little bit. Okay. Okay, very good. Okay, so for this next one, we'll be doing two things that are very similar, but a little different. Okay, first one, we're going to be essentially tracking this light. Okay, we're going to be tracking it through an object. So the object this time is going to be my hand. So I'm going to place this hand right about here. Okay, just like this, covering more or less a majority of your eyesight. Okay, and I just want you to track the light. So I want you to try and essentially think about where it's going to be. Okay, and again, I only want you moving your eyes. So we don't want to see any kind of movement with your head in this part of the exam. Okay, so only your eyes. So we're going to start right about here, and we're going to get moving, okay? So here we are. Very good. Good. And relax. Excellent. Okay. All right. So now we're gonna do the exact same thing. This time, the distances are going to be much smaller, and we're going to be utilizing this. So, essentially, what you're going to do is you're going to cover your face, and on one of the pinholes, you're going to slowly be seeing the light. And I just want you to follow the light, and then we're going to be flipping it and using it on the other side. Okay? Very good. Okay. So let me get the light that we're going to be using. And let's go ahead and have you hold this. Okay? So you're just going to hold it right about there. Okay? I'm going to hold it right about there. And we're going to go ahead and just start shining the light. Just like that. And all I want you to do is follow the light as much as you possibly can. Very good. Good job. Very good. And let's go ahead and get it on the other side as well. So here we go once again. So, yeah. Very good. Good. Good job. Excellent. Okay. You're doing very well so far. You're doing very good. You're following all my instructions correctly. It's good to see. Good to see. Okay, let me just quickly jot that down. Okay. So, going to ask you now to go ahead and just look at me right here in the chin. Very good. And I'm going to hold up my hands just like this. And now, very good. And I'm going to hold up my hands just like this, actually like this. And what you're going to do for me is you're just going to let me know which of my two fingers moves first. So you're going to say either left or right or both. Okay. Very good. So we're going to start right here. Okay. Here we go. Good. Good. Good job. Very good. Good. Very good. Good job. Excellent. Good. Good. Very good. Excellent. Okay. Now, I want you to go ahead and cover your right eye. No, your right. Good. Excellent. Same thing. Very good. Good job. Good. Very good. Very good. Very good. Excellent. Now, please switch and cover your left. Excellent. And now we start again. Very good. 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 Very good. Good job. Perfect. Good. Good job. Beautiful. And relax. Okay. 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 Very good, very good. Okay. Interesting. Interesting. Okay. So, here we have what a lot of people would refer to as their favorite part of a cranial nerve exam, which is usually the taste test. So, we're going to go ahead and we're going to pick out about three flavors here. There we go. Excellent. All right. So, I'm going to start out with this one. Okay. And just to give you a bit of a warning, all of these are not going to be very common flavors. So, again, if you don't know the flavor, I always recommend that at the very least you let me know whether you feel like it's bitter, whether you feel like it's sweet, whether you feel like maybe it's tart, whether it's very flavorless, whatever you believe is the best description you can give if you've never tasted whatever I am giving you, okay? Very good. So, let's go ahead and start out with this one. There you go. Okay, you can go ahead and taste that, and we're going to go ahead and put you on a timer. Okay, and now the timer is done. What flavor did you feel like that was? Very good, actually. It is avocado. So, good job. Let's go ahead and put that here. And let's go ahead and give you this one. This is a very popular one. A lot of people really enjoyed this one. So, here you go. Here's that one. There you go. Let's give you a little bit more. Good. Good. Okay. There's that one. And let's give you a timer once again. Very good. And what flavor do you think that one was? Excellent. That one actually does taste just like, let's see if we can get that right there for you. That one does taste like coffee. Yes, coffee. Good. And now, for the very last one. Some people don't know this one too much, but some do. Okay, but either way, I'm sure you'll like it if you liked coffee. So here is this one. There you are. Good. Good. And once again, we're going to set up a timer. The timer's up, and what flavor did you think that one was? Okay, you're not sure of the flavor, but it was a little sweet too. Okay, excellent. Well, just in case you didn't know, it was a cake flavor. To be more specific, it was bizcocho de tres leches. If you don't know what that means, it means it's basically a cake of 3 milks. Okay? Yes, that's Spanish. Okay. Okay. All right. So, I usually try to break up a little bit of the eye examination portion with that, just because I know that it can be, your eyes can get a little tired. So, now what we're going to do is we're just going to do one more part for the eye exam, and I'm just going to ask you to please, let's get these right on here. There we go. And I'm just going to ask you to look right here for me, okay? And you're just going to go ahead and focus right here, okay? Very good. Good job, good job. Excellent. Okay, can you please focus both your eyes on this light right here? Good. Just look at it. Yep. Good. And now look at this one. Good. And now I want you to go ahead and cover one of your eyes. Good. And look directly into this eye. Good. And now switch. Good. And now I'm sorry about that, bumping into you. And now if you will, please look at this right here. Good job. You can go ahead and relax for me. Okay. All right. And now I'm going to go ahead and flip this. And I'm going to flip this. Just let me know when this timer is complete. Okay, so let's go ahead and get this really quickly. Okay, so for this next portion, I'm going to go ahead and see how your coordination and your muscle coordination and your muscle reflexes all are. So this could take a bit of time. So what we're going to start off with is we're going to start off with your hands. Okay, so what I want you to do is hold up both your hands like this in a fist. Good. Yep. Now I want you to bring them together and put them like this. Okay, very good. And then slowly open them like that. Good. And now bring them back. Good. And then open them again. And now lean them over, so like that. Yeah, you can. I want you to push as far as you can. Good. And now the other way. Good. And now I want you to go ahead and slowly do something like this. Okay. Very good. And now let's bring them back out. Hands open this time. Good. Now you're going to touch each of your fingers, 1, 2, 3, 4, to your thumb. So we're going to do 1, 2, 3, 4. 1, 2, 3, 4. You do it. So we're going to start off with your left hand. Good job. And now with your right. So 1, 2, 3, 4. 1, 2, 3, 4. Very good. Very good. Now, let's go ahead and grab this. Okay. So, you're going to go ahead and cover your left eye. Good. And now with your available hand, you're going to, with your index finger, you're going to touch your nose, not mine, your nose. Good. You're going to keep it right there. And I'm going to place my hand right here, and I just want you to, with your index finger, you're going to touch my hand. Okay, so go ahead. Good. 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 Now switch. We're going to cover your right eye now, and other hand on your nose. Good. So, same thing. Good. 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 Excellent. You can put your hands down. Okay, so then this is the next one. I'm going to ask that you, this time, instead of verbally telling me where the light is, you're going to point at it with your finger. So you're going to move your hand just like this, okay? So if I have the light here, you're going to point that the light is over here. If the light's over here, you're going to point that the light is over here, okay? Excellent. So we're going to start and go. Good. 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 Very good. 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 Excellent. And relax. Okay. All right. Let's go ahead. I don't have a pocket for that. So what I'm going to ask you to do now is just try to relax your face for me. Okay, very good. Okay. I'm going to ask you to relax your face. And what I want you to do is please go ahead and I want you to raise your eyebrows for me. So you're going to make them up just like this, like you're surprised. Yeah, and then furl them as well. Good. And what I'm going to ask now is that you, when you have them in the surprised, put them back up. Good. I'm going to put my hand on it, and I'm going to try and resist from you bringing them down. Okay. So I'm going to put my hand on your eyebrows, just like this. Okay. And now I want you to go ahead and resist. Go ahead and bring them down. Good. Good job. Okay. And now, can you give me a great big smile with no teeth? So, good. And now, with teeth. Yes, just like that. Very good. And now, stick your tongue out. Very good. And if you will, please, go ahead and make a bubble with your cheeks. So, like this, and hold it. Good. And I'm going to put my hand on your cheeks, and I want you to try and resist me popping your cheeks, resist me popping your bubble. Okay? Just like this. Good. Excellent. All right. Now, if you will, I want you to, what I would like you to do now is move your head to the left. I want you to look straight this way. Okay? So like this. Very good. And now straight the other way. Just your head. Good. Now look straight up. Good. And now look, tuck your chin. Excellent. Very good. Very good. Now, please, I'm going to put my hand on your shoulders. Okay. Just like that. And now, if you will, please go ahead and shrug. So you're going to do this. Okay. You're going to bring them up. Okay. Good. And now down. Good. Excellent. Very good. Okay. Now what I'm going to do is I'm going to take this pen right here, has a light, and I'm just going to pass it along your face, okay? And as I'm passing it along your face, if you ever feel like there's a bit of a numb area, maybe it doesn't feel right or doesn't feel equal to the opposite side, please let me know, okay? So I'm going to start off right up here, right on your forehead, okay? And we're going to work our way down. Very good. Good. Excellent. And we're gonna work on this side as well now. Good job. Okay. Excellent. Okay. And any discomfort or anything like that? Okay. So, next part. I'm just going to have this light very close to your eyes. Okay. And as it's very close to your eyes, all I want you to do is actually just follow the light. Okay. I just want you to follow the little pin as it goes around your eyes. Okay. So I'm going to hold it right about here, and I just want you to follow it, okay? Very good. Excellent. Good job. Good. You can relax for a moment. Okay. Okay. Very good. Okay. So, what I'm going to do now is I'm going to pinch a couple places on your face, and during these pinching moments, I just want you to let me know if it causes any kind of pain or a discomfort. Obviously, I'm pinching your face, and it's going to be a little bit, might be a little annoying, but it's just for you to let me know if there is a underlying pain, okay? So, I'm going to start off about here, just like that. Okay. How was that? Okay, so that's pretty much what it's going to be like, okay? Good. Good. Just gonna go ahead and touch your face right now. Okay. So, yeah. Okay. Let's go ahead and see. Just a little bit right here. Okay. Okay. Very good. Good. Excellent. Okay, very good. Okay. Let's go ahead and check your ears now, okay? So we're just gonna we're just gonna go ahead and take a look at your ears, and what I'm gonna ask you to do is to look straight ahead, okay? So this is going to be the ear exam, ear hearing test portion of the cranial nerve exam, okay? So far we've already covered the eye test, the vision, the ocular motion of the eyes, and all of that. We checked out the nose, that sense of smell. We've checked out your sense of taste, and just to make sure that everything is going well, muscle coordination. Okay, so now I'm going to ask you to please look straight ahead, and I'm going to go ahead and take a look in your ears, okay, and make sure that everything looks okay at the moment. All right, perfect. So if you will, please allow me to. Okay, everything looks good. Okay, very good. Very, very good. Good job. Ear looks perfect. Very good. Now, let me take a look at this side. Alright. Ear looked good on that side, just to let you know. Let's take a look at this one as well. There we go. Okay. Okay. This ear looks good. Looks perfect as well. Very nice. Good. Very good. Good job. Very good. Okay. Just going to be moving your ears around just a little bit. I'm gonna pull them just a little, not like you're a little child, like maybe your parents did at one point, but just to see if there's any kind of pain or discomfort again. Okay. All right. So we're just gonna start out on this side. Right now. Okay. And how was that? Did that bother you in any kind of way, like while I was moving it around? Okay, even when I applied a little bit of pressure, nothing like that. I cupped your ear a little bit. Okay, excellent. I'm gonna do the exact same thing on this side, and once again, just try to think about those things. Let me know if it hurts, anything like that, okay? Beautiful. Excellent. So let's go ahead. I'm going to go ahead and cup your ear. I'm just gonna cup it right now. Okay, excellent. Very good. Now, we're going to go ahead and use the tuning fork right now, okay? Let's take a quick look here. Very good. And this as well, okay? So, today we're going to just be using a very standard tuning fork, and what I'm going to ask you to do, let's take a quick look. Okay, excellent. So I'm just going to ask you to let me know how long, well, you're going to let me know when you can no longer hear it, okay? So we're going to start on this side, and then we're going to move to this side. And you're just going to let me know when you cannot hear the tuning fork anymore, okay? Okay, so let's go ahead and start. Very good, very good. Let's go ahead and move to this side now. Very good, excellent. What was that? No, doesn't hurt. See? Fine. I'm hitting it right here on the meat, so. Okay, excellent. Alright, so I'm just going to go ahead and ask that you let me know, when do you hear certain sounds on individual sides, okay? So we're just going to start out with this sound, and you're just going to let me know on what side you hear it on, okay? So here we go. Very good. Okay. Good. Did I get this right? I did. Okay. Sorry about that. Good. Very good. Good job. Very good. Relax. All right. Here's your next one. Very good. Good. Okay. Very good job. Good. Good. You're doing very well so far. Good. Okay. Okay. Here's the next one. Here we go. Okay. Good. Good. Good job. Okay. Very good, very good. Okay. Let's go ahead and, oh, almost forgot. Let's jot that right down here. Very good. All right. So, that today does conclude today's examination. And let me just quickly grab your file. Okay. That does complete today's examination. Okay, and it seems like you did everything all right. Everything did go well. The only thing that I did mention was that we would like a follow-up for your eye examination, seeing that it's been quite some time since you've actually had one. I'm sorry for today's examination being so long, but it is a cranial nerve exam, and seeing as you've been having multiple of my express visits, I just wanted to make sure that we were thorough and very detailed with this one, okay? With this exam. Okay. Okay. Let's take a quick look here. Okay. Overall, how did you feel about today's examination? Other than it being a little long. Okay. So, I do see here that your medical insurance provider will not be covering today's examination, but we do have a very easy way for you to be able to easy way for you to be able to pay for today's examination. At the front desk, all you have to do is go ahead and press. There is a thumbs up icon that you can just press before leaving today, and it's going to go ahead and give us a positive rating on Yelp, and then this way is your form of payment. Okay, perfect. So with all of that set, I do have one thing that I do need to tell you, and it's that only about, let's take a look, just so I can give you a very factual number. Don't want to okay, so only about 2% of the current population would have been able to actually pass this current examination, even though everything was all right with you. Okay, so the reason for that is that the only way that you could have passed today's examination was if your name started with the letter C. So if your name started with the letter C, make sure that once you hit that button that is an icon like this, which is a like, make sure that you let me know what your name actually was, okay? Even though I have it in this file. Excellent. So, it was a pleasure taking care of you. I am Dr. Hit, and I hope to see you again. Have a good day.